tribal and the rural areas for the last 40 years. Exactly now it is 40 years. I went to Bihar in 1980.
Wonderful.
I'm not giving a professional talk. Okay. I'm not giving a professional talk but sharing my experience. The relevance of reaching the healthcare to the unreached. Just the overview of the Indian situation. This is what struck me when I was in medical college. We have PET scans, MRIs, we can do heart, liver transplants in major cities now. But in very remote areas, we still do not, when it comes to diagnostic, we don't have a simple microscopy facility. There are people, let alone heart transplant, people dying of simple hypovolemia with 2 grams hemoglobin. That's a tragedy of this country. So health services for the SCs and STs is poor. The most important is out-of-pocket expenditure for the poor is, now it has come down to about 66%, but still 70% is very high out-of-pocket expenditure. Plus financing overall in the country, it's still 1.3. I made it 1.6. I was in the WHO Commission on Macroeconomics and Health. I was the chairman of the task force and I was in one of the subcommittees. So you heard about Commission on Macroeconomics and Health. Very briefly, that commission, till now we thought by industrialization, by improving the economy, we can improve the health. But we were asked to prove that by investing on health, we can improve the economy of the country. And we did it very well. And similar commission was set up in India. Sujatara was, when she was a secretary, she did it. And then we have come out with a similar this thing. Public spending versus private spending, still 1/3, 2/3. But I think public spending should increase. At least if it is 2%, it will be good. So per capita, when it comes to reality, I'm running primary health centers. The average cost of providing primary health care, comprehensive primary health care is 200 rupees per person per year. That's $3 per person per year is what the government is spending. So with this background, let me say why I came to reaching the healthcare to the unreached. I was born in a village, it's now a big town, but my mother had a choice. My sister was born in a child hospital, but I was born in the cowshed. My mother decided going to a child hospital is cumbersome. Let me deliver at home. And delivering at home in Indian situation is you cannot deliver inside the house. You have to deliver in the cowshed. Cowshed has the hay, which can be easily disposed and burned. We don't have to worry. So we had that place. I am saying this with a definite context. Later on I'll come back to that. Again, I came from Yamalur to Jainagar first block. My father built a house. I came in a bullock cart with my grandfather and my sister. We started at 8 o'clock. We reached Bangalore by 3 o'clock. I think the traffic jam sometimes we take the same time. So I came here, studied in a Karuna medium Rani Sarvadevi school. And when I was 12 years old, I went to with my father. He had returned from, he was working in a chair, he had a training in England, come back. He looked very healthy, but I went with him. We walked from Jainagar to Madivada. And my aunt's place probably had a massive heart attack. I went to the garden, plucked some flowers and came back, and then he was gasping. So I could helplessly watch him die. And I ran to get a doctor. There was one guy back. He was smoking weed still. I remember his face. And I brought him after half an hour. He could not do anything. Then we rushed to Bangalore nursing home. So nothing could be done. So that day I didn't cry much. But I took that as a sign that I will become a doctor. Rest of my life I didn't want to helplessly watch somebody close to you dying and you can't do anything. That was a terrible nightmare for me. So that's how I came up, and in my middle school, I had what's called double promotion. I didn't study third standard. My teacher thought I am good enough. I jumped from second to fourth standard. But Bangalore Medical College, I was in the first 30 for the state, but they caught me. I had to complete 16 years by October 30th. I was completing on December 30th. So next year you have to join. So I took off, and then I was cycling from Jayanagar first block to Krishna Progress. My father had a friend, so they gave me a job. I used to earn 110 rupees, my salary. And 3 months salary was my entrance fees to Bangalore Medical College next year. So, so then that was the time I went to Ramakrishna Ashram in Bangalore and studied about Vivekananda and Gandhi later, both of them influenced. So what was, to become a doctor, it became saving lives. So reaching the healthcare to 100. That's a big background. So I started my career, first I worked with the Ramakrishna Mission also in Himalayas, in a place called Mayavati where Vivekananda had established the ashram. Later on I was in West Bengal also for some time, then came to BR Hills in 1990. So I started in Veerapan's territory. We also work now in Maoist areas and in the northeast where insurgency is a problem. So most of them are remote, hilly tribal areas where there is no electricity, no telephone connectivity, and both public and private facilities are not available. So I started with Solina tribal people. How many have been to BR Hills? Oh, very few, sir. Okay.
This is why we love
I think
next start meeting there.
Yeah, definitely. So all of you should visit. They belong to the Vedant group. They were doing shifting cultivation. Parents earlier was a wildlife sanctuary, now it is declared as a tiger reserve. So my own understanding of tribal development, I was also influenced. Have you heard of Albert Schweitzer?
Yes.
Anybody? Only word you have. Okay. He was a missionary, German missionary who worked in Africa. And we had a non-detailed text, so I was also inspired by Albert Schweitzer to go and work in very remote areas. So I started with curative health, saving lives from snake bites, mauling by bears, seasonal pneumonias, all of that was very satisfactory. Then I found a whooping cough as an epidemic in Puranakodu, so we said we have to do immunization also. From curative health it became community health. I found I had no pills for poverty, so community development became very, very important. And in community development, most important was access to natural resources, land issues, and we have been fighting for that. Then, this is a biological hotspot, the BR Hills, so we call it sustainable development now. So, the type of, we believe in comprehensive primary health care, preventive, promotive, curative, and rehabilitative, understanding traditional medicine and building on it. This is the hospital. We have mobile units which goes around. These are the herbal medicines which are used. Human resources in tribal area is a big challenge. So we tried an experiment with 7th pass tribal girls. We trained them as ANMs, auxiliary nurse midwives. They were doing very well, but nursing council refused to recognize them. So we took it as a challenge. They have passed 12th and regular ANM course, and they are continuing their services, doing health education. Abdul Kalam has been
I don't know what's wrong with this.
Oh, I don't know, man. Abdul Kalam, when he was in DRDO, he telephoned to me, and this is the exact words he said. One of the spiritual person has told, find 100 punyatmas who can transform the country. I've heard about you, I'm coming there and spending time with you. He came all the way, spent one full day with us. Later on, he took me also to meet the other so-called punyatmas, and we went from finding those punyatmas. We started with Bankar Rai and several others. So when he was president, we thought he has forgotten us, but we invited him for our 25th anniversary. He remembered, he came all the way as President of India, he celebrated his birthday with tribal children. He always talked, encouraged about our work, and told in most of the medical convocation, in the medical colleges and universities. So we have been doing this. I am always for livelihoods, and I'm happy we have been fighting for the land rights. Today, all the tribals have got land. I was also in the jail for 2 days fighting for the land rights. It was a wonderful But Madan Gopal was the assistant secretary. So he came, he solved the land issues, and that's how it was worth being in jail, because we got the land rights, at least the land which was alienated from them, we got land back to them. And today, most of the, again thanks to another very committed bureaucrat, because as a DC, though there have been efforts in other districts, but Chamarajanagar district, almost 90% of the tribals have got lands and community rights over the forest. So that happened about 5 years ago. Chakravarti Mohan was the first. We have a wildlife sanctuary, as I said, and care of the land, care of the people, and care of the wildlife. And so the Solidas, about 25 tribal youths manage this facility. The guests will have a good experience. When you come there as guests, you can also see that. And we also do some conservation activity. These are the cottages which we have there. It's a reception. These are the cottages. And when I started this, again, one of the bureaucrats who said we want to do ecotourism and then make it central. And we had to raise about 40 lakhs every year for tribal development work. Today we get as both rent and profit about 40 lakhs as a regular source of income from this. And it's very successful, but there are a lot of obstacles. Recent, you might have seen in the papers about some struggle. They are calling it is profit-oriented, and how can we do land alienation for ecotourism? It cannot, all sorts of problems. Chief Secretary knows, he laughed at it and just tried to solve the problem.
So money go from
Yeah.
Hello, but here is something.
Can you
hear it?
Hello, can you hear? Yeah, okay. So we now cover Karnataka, Arunachal Pradesh, Meghalaya, Manipur. I just want to share, I've been in the planning at the state level. The greatest joy I've got is planning the healthcare for the vanishing tribes. I call them vanishing tribes. The Great Andamanis, the Onges and Jarvas and Chompins. These are the 4 vanishing tribes in Andamans. And of course, we can't plan for sentinels. Have you heard of sentinels?
Yes.
Okay, we can't. So recently, one of the missionaries tried to go there and they killed him. So I think there's no need for planning for those people. Leave them as they are. They plan themselves better. But this was a challenge, and we did it. These are the Jarvas. Jarvas are about, I spent 2 days, 1 to 2 people, blood pressure around 100 by 70, very healthy, smiling all the time. Only the language has not been deciphered by Central Institute of Indian Languages studying it. So only sign language. And finally, our recommendation to Jarvas was no immunization. First time in the country we said no immunization for them, because pulse polio drops itself can cause flaccid paralysis, and there is no pulse polio in the community. Why introduce them? So let us observe and wait and observe. But it was first time in the country a decision has been made that no immunization for this community. And there were several other. We said the best way to rehabilitate them is give the Andamans forest back to them and remove all the trunk road to be cancelled so that they come from the sea road. That was a bold decision which was made. These are great Andamanis. Their number had come down to 28. There are today about 45 people, real vanishing tribes. And for that, the government had put one pharmacist, and he had what's called a nimesulide drug, which is syrup. Nimesulide is a banned in Europe and America, and it should never be given to pediatric children. But they had that syrup. I wrote a very strong letter in that and said we should have a policy. Only very essential drugs should be kept in that, and not these harmful drugs. So we have now a policy with essential drugs for them to manage their care. So what is the lessons we learned from the tribal healthcare? Decentralized planning and implementation is very important, because like for Jarvas, you have to have a decentralized planning. You can't trust the mainstream health plan. Respect traditional wisdom and build on it. I forgot to show that slide, it's missing. When I went to VR Health, my first case of complicated delivery came. I was in a thatched hut, I started my hospital. But I had trained in Bangalore Medical, so I put my obstetric table. So the tribal woman refused to deliver on the obstetric table. I was forced to deliver in the corner of that hut, and I thought it was a superstition. Today, so they conduct deliveries in squatting posture. They have a rope hanging, they lift themselves up, and gravity helps pelvic muscles can contract better. And I was, with the help of the traditional birth attendant, I was forced first time in my life to conduct a delivery in squatting posture. So today we have two labor rooms. One is the regular squatting posture. 90% of the deliveries happen in that. Only those which have complications, you need episiotomy, you put them on the obstetric table. So why have the people not doing it? To conduct delivery in the squatting posture, the doctors and nurses get back pain. The obstetric table, they are more convenient for the doctors and nurses. It's true to a great extent. Now they are designing to conduct deliveries in squatting posture in a chair fashion. So those are the things we need to learn from that. So I have been instrumental, Dr. Abhayman and myself, all our experience, there was a committee for tribal health in India, and NHM, I called it openly in that it's a sin. They never thought of tribal health care in the National Rural Health Mission. There was no mention of it. They were all clubbed together as marginalized people. There was no separate, so we have been very emphatic, trying to say that there has to be a separate. Now we are saying there should be a tribal health mission. Mission mode should take up, and this report has been very useful. So I was working in the hilly areas, but I found tribals didn't have very serious leprosy cases, recent infections. Then we found at the foothills in Edagur Taluk and Kodegal Taluk a lot of leprosy cases, hyperendemic for leprosy. It used to be about 22 per thousand. So we said I got trained in Vellore, in Karigari, so started a leprosy program under Karuna Trust. And we also have a peculiar type of epilepsy called hot water epilepsy. In South India, they take hot water bath once a week. They do oil massage and take a good hot water bath. When they take hot water bath, starts with become euphoric, what we call complex partial seizures, then becomes general tonic seizures, real fits they get. So simple health education, especially mothers when they give birth to the children, they put their hand and pour the water on their palm, not directly on the head. That can prevent the attacks. So we revived. Dr. K.S. Mani from NIMANS came and we did a wonderful epilepsy control program. And we also, CPAG wanted to give us free carbamazepine, an epilepsy drug. We somehow refused it. It was an intuitive refusal because it's something coming very cheap. Then we could publish paper that we could manage the rural epilepsies by two cheaper drugs, phenytoin sodium and phenobarbital. And carbamazepine was needed only for 2 to 3%. That was when they were trying to push that drug in a big way. So it was a wonderful program, and all this were done by begging money and doing parallel work. I found there is a primary healthcare system. The government staff lazy around and we do the donkey's job. And I have to beg money to make this. So I met the health secretary at that time. I think it was Gautam Basu at that time. I said, why not we have partnership? Whichever primary health center you are unable to manage, you hand it over to us, we will do it. So I want to clarify this concept of public-private partnership. Public, private, there are two players here, for-profit and not-for-profit. Even not-for-profit is dubbed under private sector. So I want to make a distinction there in the private sector, NGOs and the for-profit people. And the partnership is also very important. We do not want to be the contractors of the government. We don't want to be the contractors of the government. Contractors means percentage in government. So that's why we say truly partners and involve us in implementation in policy formulation, planning, implementation, monitoring, evaluation, training and research. And thanks to Karnataka government, we had wonderful bureaucrats. I feel in Karnataka they have given an opportunity to be part of the entire thing. They never treated me as a contractor, but it should happen in other states also. So this is our comprehensive primary health care, preventive, promotive, curative and rehabilitative palliative care, appropriate technology and multi-sectoral approach. So we believe in comprehensive primary health care, which includes mother and child health, all communicable diseases, non-communicable diseases, all community processes, strengthening village health and sanitation committee, Rogi Kalyan Samiti, and then other determinants of health. We are also responsible for quality of water, sanitation and nutrition. So this is the usual primary health center. So we started this with the Gumbadi Primary Health Center. This we started in 1995-96. IMR used to be 76. You see small spikes in between, they gave larger population, more sub-centers were added. And I'm proud to say in 15-16 we touched 0 IMR in 1 year. Difficult to maintain, 0 is very difficult to maintain, and we are sustaining now at about 1 or 2 deaths. And so this we did with the same budget which government is spending, which is 200 rupees per person per year. So my model was to show that this partnership was to show if I want, I would spend at least 600 rupees for the comprehensive primary health care and make it a model. But government say you are spending more money, you will achieve the same results. I wanted to show with the same money which the government is spending, we can achieve much better outcomes. That was the main purpose. This I am very happy to show that there are now safe institutional deliveries. They don't have to deliver in the cow shed like me. And I am happy that now I am instrumental. Every year we deliver 20,000 safe deliveries throughout the country. And that incident, that has a connection to that, that's what I am saying. So the IMR has come down in overall in Karnataka to 5 per thousand. I think today's paper says it is about 25 per thousand. So it has come down. The state average also is fairly doing well. Ours is only 5 in our PNC. MMR has come down to 45. So we have made, within this limitation of 200 rupees, we have made several innovations in primary health care. I call them process innovations and technological innovations. Cost-effective healthcare delivery. We have telemedicine, Logistimo for drug logistics. We have monitors in the cold chain. Now government has adopted it and it's being done. We also tried a drone to deliver in remote areas. In the remote areas to deliver emergency medicines, which would be very useful in Northeast. And we have been using, we are the first in the country, 20 of our primary health centers have electronic medical records. And in Gumbadi PSC, we have also what is called EMR is for those who come as patients to the clinic. But the rest of the people, they have what is called electronic health records. So 23,000 people in Gumbadi PSC have health records. This is also first in the country, which we have been able to do. We have this tele-ECG. So we have built a important thing. We have 24 items. We can manage all the emergencies in the primary health care. Neonatal emergencies, obstetric emergencies, snake bites, all the emergencies in primary health care can be managed. We also integrate traditional medicine into primary health care. Identify about 20 herbs, single herbal remedies which they have been using and integrate it into them. According to us, I am not a fanatic to say that everything can be done by traditional medicine. About 10 to 15% of primary health care problems can definitely be done with the traditional medicine. I just want to show, this is Adatoda Vasaka, so Adusoge anತಾರೆ. 2 leaves of that is a very good cough remedy. So we don't want to have cough syrups in our primary health centers. My definition of cough syrup is colorful bottled sugary syrup, 3 to 4% alcohol, few paise worth of antihistamine, which costs 70 rupees, Codex, Benadryl, all of them. use that money for nutrition and boil these 2 leaves and drink. That's a good coffee. So we are making such interventions for the government.
So what is that leaf called?
Adatoda Vasaka, Adusoge, Kannadadalli Adusoge. Mental health was only in new hands. Then they said district mental health program, but it had not reached the primary health care. We have shown in all our primary health centers, we are able to manage all the psychotics, bipolar disease, schizophrenias and depressions, all of them can be managed in primary health care itself. We also manage epilepsy along with that. We have shown that, and that model is being replicated throughout. And we also have a Manasa in Mysore, where homeless mentally ill women and men roaming around the streets, we rescue them, take them to judicial custody and provide psychiatric treatment. Once they remember their addresses, we rehabilitate them back to their families. Nearly 370 people we have done. Management, now LCDs has become very important now. So again, with 200 rupees, we have to screen all the people for cancers, oral, breast and cervical cancers. So we took it up as a challenge. Oral cancers, you need a torch, just examined by a torch. Breast cancer, self-examination, trying the ASHAs and ANMs by palpation, we can pick up. Of course, very early once mammograph is the best, but we can't afford it, so we do self-examination and palpation. Cervical cancer is again, the 2 important tests is pap smear and HPV test. Both of them are expensive. Pap smear costs about 400 rupees and HPV costs about 1,200 rupees. So what we have is called a VIA method, visual inspection after applying acetic acid. By doing that, you can visualize all the lesions in the cervix. So that needs only 10 paise of acetic acid.
Okay.
So that's how with that we were able to screen all the entire population from Badu PLC with no additional cost. We are not only training cost. With training the staff, we could do the screening of the entire PLC. I was interested in health insurance model. Sujatara was again the secretary, and with WHO, first time in the country, with an insurance company, national insurance company, we said 30 rupees was the premium collected from the women's self-help groups. And I had a long negotiation. They had a big list of exclusions, newborn, everybody has to be that. But we will take care of the major source of out-of-pocket expenditure even in government hospitals is the additional diagnostics and the drugs. So we said this insurance will take care of those additional diagnostics and the drugs, and it worked very well. So that, later on that experience, I was also involved in the H program. How many of you know about H? Okay, good. That's for the cooperative members. Dev Shetty also as a pioneer with 5 rupees per month, 60 rupees we started with that. Later on it became about 300 rupees, equal share from the government we were able to do. And again, I am part of the H Sudarshan which combined the Yashaswini and the RSPY and the health departments, all 3 combined now. We have joined the Prime Minister. It's a wonderful scheme. We are now covering about 1,400 procedures. Our BPL list is about 58% of the people are under BPL. So all of them get cashless free treatment. The cancer code, 58% of the people, if they have cancer, they get their surgery-free, radiation, and even chemotherapy. All 3 are provided cashless. So it's being done. And for above poverty line, 30% they have to pay. And co-payment 70%, 30% government pays and 70% they have to pay. So wonderful thing, and thanks to set on the right footing, we learned lessons from Andhra model, reduce all the hazards, and then without much corruption, it's going on very well. The Yashaswini, there was a lot of resistance to merge it with one single agency. Yashaswini was done by cooperative department, RSPY by labor department, and Vajpayee Aragashri by health department. Each one was not talking to each other. And Yashaswini, the cooperative secretary, I still remember, he was so possessive. The name of our daughter was given to the program, and he didn't want health department people to meddle with that. So we had to break the ice and bring all of them together. So ASHA training, I am with ASHA mentoring group at the national level. Community planning and monitoring involving VHSNCs, empowering them is been important to community processes, teaching them PRA techniques. So each village has to have their own plan. They also do action and they also monitor the services provided. So this program is going on throughout the country in a big way. We have citizens help desk in major hospitals, mobile health units. So we started in southern Karnataka. We have now in almost all the backward districts in Karnataka. And that was when I got a phone call from Arunachal Pradesh, the health secretary there. We want to have PPP for primary health care. And you are the most experienced, we will give you the most difficult ones. You want me, and then you mentioned me, I went there. And Soligas are very peace-loving people. In northeastern tribes, either they have a dagger or a gun with them. So it was a tough. I had seen in a hospital, he was an ENT surgeon, his hand was chopped because the patient died. So there are such risks involved. So we went there in 2005. I'll quickly show how the PLC. This was a walking PLC. No electricity, no telephone connectivity. I had to walk 10 kilometers up, 10 kilometers down to take over. We were asked to take over. When I went there, one big group fully drunk. That's how it was. No other staff available, and they gave me that PLC. And even today, there is no electricity, no telephone connectivity. But it is fully functional now. We have a generator. And this is how the pharmacy was when we went there. Now we have all the essential drugs available in that. Waka PSC, the insurgency problem. In Northeast has its own. Of course, in Karnataka, I've been fighting about the vigilance director. So corruption in Karnataka is less compared to Northeast. The health minister himself wanted 8% of the contract. Openly asked for 8%. Said I will close down, and somebody, it's easy to meet the chief minister. They took me to the chief minister, he was convinced, he said no, you continue. So I am proud to say, even in such corrupt states, I get most of the money for PPP, about 90%, we add about 10%, nearly 30 crores. And I have not paid a single pipe bribe, and still get this money from the state. The beauty of it is there are good people like him who are in the service, who are honest, and one day we have to find them. I made use of Madan Gopal extensively. I mean, once you have their support, we don't have to walk down to any of these problems. So you should know the knack of getting the right people. So the Waka PLC, again, insurgency is a problem in North. Even the collectors, all government officials have to pay 15% of their salary to these underground people. They come and collect. So they wanted from our fields. Said I refuse, I would rather close down. I have not given to the ministers, so why should I give it here also? But they also watched our work. They said we are accepted. I had exemption from Viraka, I had exemption from Mayos and insurgency people. So we have not paid any bribes to them. Italian PNC, again, this, there are two districts in Arunachal Pradesh. Now I think Italian they are trying to stay. Even the collector does not stay in the headquarters. He used to stay in the other district headquarters. So very remote areas, because there were 2 months, the district headquarters is also cut off. Very remote areas. These are the PLCs and infrastructure. This PLC, the JE PLC, they didn't have any quarters. I myself stayed in a thatched hut in BRX for about 15 years, so I could convince this young couple, doctor and a laboratory technician. We built with 10,000 rupees a quarters, and we stayed in that for 2 years, and today we have much better quarters. So we have committed people everywhere, that's what I'm saying. There are people, we have to just motivate them and also show our own example that they will also do it. These are very remote PSCs working in Kolang PSC near China border. These are the roads leading to Arunachal Pradesh from Assam. The Brahmaputra river is not like Kaveri, so very tough. 2 of the PLCs, they use the elephant to cross the river. Boats also we can't use. They use elephants from going from one sub-center to the village. Very, very difficult areas. This is my model of reaching this village is cut off for about nearly 4 weeks during the monsoons. and but she doesn't want to miss her immunization day. So every week she uses the ropeway with the vaccine carrier, goes there and immunizes people. This is my symbol for reaching the healthcare to elderly. There are such committed youngsters who are ready to work. We have to create opportunities for them. This is our PHC staff in the Northeast. Okay, that's briefly about our healthcare. We have now added the sustainable energy into health centers. This is with the Selco Foundation. There is a good partnership where we are providing good energy. All these primary health centers, we have alternate decentralized energy. We have solar powered vaccine refrigerators. So we cover at present Arunachal Pradesh, Meghalaya, Manipur, Orissa, Karnataka. We just started a project in Rameshwaram. Uttarakhand also we have a project. So these are it has scaled up. Started with 20,000 people in VR Hills. Now we are in the cluster of Kollegala and Chamarajanagar district. Today we are covering 1.5 million people's primary health care. That's our area of operation. These are the quality in healthcare is very important. NABH, National Accreditation Board for hospitals. So I made them change into National Board for Health, and they have to do PLC accreditation also. So I'm very proud of that. Mumbai PLC is the first in the southern state to get it. Now we are trying to go. Then I found they are very expensive. We don't have budget. For NABH accreditation, you have to spend about 3 lakhs. So I use the same standards for quality, and with ISO it's much cheaper. I can do it with nearly 75,000. So I do it with ISO than with NABH because they are cheaper. And the government is also coming out with the help. So PPP, when we started, Gautam Basu said it's the first time of the project, so you have to convince the finance department. So we will give only 75% of what we are spending. I said, okay, I wanted to start the partnership. Then they made it 90. In Karnataka now they have made it 100, but they don't give monitoring, supervision, training costs. Still, but in most of the states they give only 90% of what they are spending. This is 90% of 200 rupees per capita, that's what I am telling. And we spend less than the government with much better health outcomes. We have a fellowship program for primary health doctors to qualify as the family physicians. So most of the financial resources for Karnataka state governments, as I said, thanks to the good bureaucrats, it would not have been possible without committed. That's why the whole country is surviving on, they are about 10 to 15% of the people. They are committed. They don't want to change. They keep it up. I've seen people very closely, including Madan never most incorruptible. Maybe there are also 15% genetically incorrupt people. You can't change them. I also it's impossible. Just as we have the rest of the people, I call them as fence sitters. So these 60% of the people, if the head is as a DHO or as a health secretary, if he is good, they join that. So 15% plus 60%, 75 to 80%. Forget this genetically incorrect people. We sideline them. We should not waste money trying to convert them. With 80% of the people, we can do it. This has happened during Madan Gopal's time. I was also made the chairman, I will quickly go through this. I was made the chairman. I was managing 20,000 people's healthcare. Suddenly, the SM Krishna was not SM Krishna, it was SV Raghunath, who was his, he invited me, made me the chairperson. We had to look at the entire health sector and make complete recommendations to improve. Fortunately, I also added the last one and monitor the implementation of the recommendations. Usually, a report will be adore the bureaucrats and ministers' mirrors. I didn't want that. So they were good enough to add, see that I also monitor as chairman, monitor the implementation of this recommendation. I worked with government for 4 years, and we were the first in the country. We have a Karnataka state integrated health policy. At national level, we have supplied health, population, drug, nutrition, medical education, blood bank, all of them are separate. We integrated all of them into one integrated health policy, which has been accepted now in the state. In the report, we identified 12 major issues of concern. I will send a copy of the report, so it's more outdated, but still it will be useful to refer to it. You see, corruption was put on the top of the list. Health Secretary was very upset. How can you put, this is a government report, how can you put corruption on the top of the list? Sir, I have evidence with it. We developed evidence to show this priority. At least bring it down to 4th and 5th. I didn't agree. Presented as it is to the Chief Minister. He was good enough to accept. And there are other neglect of, I will give the report. I will not go into the details for sake of this. That's when I found Justice Venkatachala had taken charge and he was visiting the hospitals. And I was happy that he is interested in healthcare. So I met him and gave him a copy of my report. He plans to call me next day. You identified corruption as a major issue, you joined me also as Vigilance Director. So I worked as Honorary in the Task Force Chairman. I wanted to work in Vigilance Director also as Honorary, mainly to get a moral edge over the other people, and then I can be more authoritative and have the freedom to tell the truth to the government. But as Vigilance Director, we need a judicial immunity. For that, you should be a paid worker of the local. So I was forced to 1 rupee salary. I have 48 coins which are come in the treasury. So I was the official Vigilance Director with judicial immunity. And I had the unique opportunity to understand the whole corruption in healthcare. Have you heard of corruption perception index? You know all of that. So I just put it. You see, there is some improvement, but definitely we are one of the most corrupt countries. We may be on par with China in corruption, and better than Bangladesh and Pakistan, but one of the most corrupt countries. But definitely we are improving. That's a sign. From 2.0 lower the score is worse, but this is all India level. 4.1 is definitely we are making progress, but not enough. The same corrupt, the Transparency International India, they did 10 public sectors, and they did a work. Police, health, education, BDS, land administration, judiciary, taxation, railways and telecom. Most corrupt was police. I think we all agree on that. Least corrupt was telecom. This was before 2G scam. So, definitely, telecom, the corruption in the periphery, in the lower levels is much less. And health was perceived to be the second most corrupt sector. That exactly tallied with my own findings in Karnataka, and that's why I made this study very important. And money demanded in the hospitals in the northern states was less compared to southern states. The bribe giving capacity in South India is better than the North India. That's all. So doctors demanded more than the other hospitals. So again, we looked at the states, and Kerala with the least corruption as the best health indicators. That's why Bihar at that time was the most corrupt and worst health indicators. Karnataka was the most corrupt state, even according to them. Karnataka corruption was really high, unfortunately. I don't know whether Bihar has improved. There are improvements. We have a drug control department. What's the role of the drug control department? To ensure that the people of Karnataka get good quality drugs. We literally raided the drug control department. We found 2,268 samples were declared as not of standard quality. Files opened, bribes collected, no action initiated on any of them, including 126 spurious drugs. Spurious drugs means if there is a steroid, instead of steroid there is water, instead of antibiotic there is chalk powder. They are really dangerous, spurious drugs. Even on them, the open files, collected bribes, no action initiated. We made them do all that. There is a drug price control order for 75 drugs. They were selling at a higher rate, took bribes and allowed them to do it. And also when you declare that as not of standard quality as spurious drug, that batch has to be withdrawn completely from the entire country. So they purposely delayed the investigation, then kept it without informing the periphery, allowed that drug to be completely sold out. So people had consumed all of that. The pharmaceutical company got that money, but people have been suffering. Blood banks also come under that. One of the blood banks had given a HIV positive blood, which was used by a missionary hospital in farm. Again, bribes collected, no action taken on the blood bank. These were the type of things. Then we found out the drug controller had to pay 75 lakhs to become a drug controller. And he has to collect money from the drug inspectors. Drug inspector at the district level or taluka level, his job is to see that all pharmacies have a qualified pharmacist. So he gives the choice. If you keep a qualified pharmacist, you have to pay them 10,000 rupees. Otherwise, you pay me 2,000 rupees normal every month, and any quack can also run a pharmacy. Even now, there are pharmacists running like that. This took me 2 years to understand the mafia in the drug control department. I call it a cartel, and now where are the leakages and how to control it. Corruption in procurement of drugs was very serious. When the health minister himself was a physician, 80% of the budget of drugs, medicines, went for nebulizer. Why did they do that? That company was giving the maximum kickbacks. Minister will tell, purchase more. So they get, for the sake of kickback, there was no paracetamol, but the nebulizer in all our primary health centers. The procurement of drugs, PDPL, maybe this story I will tell. IV fluids, the commissioner gets a fax saying that the HAL had got that tender, public sector company, and we can't supply IV fluids. So he calls for emergency meeting and gives it to PDPL, where health minister's wife was one of the company shareholders, at double the cost. So we took up the investigation, found that the fax was sent was fake. They were able to supply. They created a whole thing and gave it to PDPL to horror stories. There was also earlier the Zilla Panchayats could procure the drugs. They themselves directly. I found they were procuring from IDPL and all of them. They were all manufactured in Hubli, labeled there and supplied. While we wrote to IDPL, we are not manufactured. So the corruption that's why I call it decentralized corruption, especially in health, is worse than the centralized corruption. Because bulk procurement of drugs is little better than what Zilla Panchayats are doing. So that's why we have a rate contract, and now we don't allow the Zilla Panchayats to procure, we centralize. This is the cartel of the drug procurement. Again, it took me 2 years and plug all the loopholes. Corruption procurement of equipment. A dialysis machine costing 5 lakhs at that time. Any of the private sector Toshiba machines were purchased. But Hubli Medical College bought it for 12.6 lakhs. And 6 of them. So we went to the commercial tax, got all the private sector people. So we inquired, and we said, if you want, we will supply tomorrow for 5 lakhs. 12.6 we have to pay this health minister, the director, and the superintendent of the police. 3 levels of, they have to pay at all those levels. And the director also took some share. But most of the money went, at least 75% to 60% went to the minister. But nowhere in the file she said, I am doing it with the oral instruction of the minister. That's why file noting would have been saved her to a certain extent. But the entire thing went on her director, but she had also taken bribes. So we had to recover from the... Have you heard of any equipment to remove cholesterol from the blood? Cholesterol, we need exercise, we need statins to remove. Every hospital has this machine, 60 lakhs worth of machine. And this, interestingly, the initiative came from the finance department. They told the superintendent, you indent for it, we will release the money from the finance department. And this machine is probably meant for some sort of physiology or demonstration only. It was not for that. Because it's a sort of dialysis to remove cholesterol. One patient, it costs 75,000. Only once they did, and it's lying there. Even today it is there. They can't dispose it from. So instead of that, we could have bought so many ultrasound machines. So the corruption was initiated from there, and we took action on that. It goes on and on. Equipment. So the overall classified corruption in hospitals for admission, issuing medical certificates, surgeries, deliveries. A woman had put her thali, got 2,000 rupees, 1,500 for the surgeon, and 500 for the medicines. Real stories. And of course, Justice Venkachalam, we made the doctors and nurses pay back that prior amount in front of the media. Earlier we started suspending them. Doctors are very happy because they get 75% of the salary for 6 months and full salary after 6 months. So they do private practice. So we stopped suspending them, at least publicly humiliate them, but anyway. And deliveries, I call it a life cycle approach. When you die also they have to buy to get the postmortem done. So the entire process was taking the patient to the OT. This was in care hospital. There you have to give the ward by 200 rupees and take him out from the OT to the ward. You have to pay 250. KC General Hospital and Bosha Hospital to show the baby after delivery. For a male baby it was 250 rupees, female baby 200 rupees. Just to show them to the siblings. That was a type of practice. Doctors doing their own private practice, having their nursing homes. They spoil the ultrasound machine in the government hospital, ask them to come to their private clinics. They spoil the ECG machine, come to my private clinic. All sorts of civil works, administration, recruitment and posting. That was a time, I have to tell this, we didn't have the counseling method. So if you want a posting near Mysore and Bangalore, you have to fetch over the local MLA. He takes 50%. The cost at that time was around 2 lakhs. And now it don't have much. 1 lakh you have to pay. You will go and stay at the Chief Minister's this thing, get his signature because it has to be approved by the Chief Minister and post them and you give that. Or 1 more lakh to them. That's what one day I stepped into Vidhan Sabha. We had one wonderful education minister called Moindega. He had put about those who come here for transfers, action will be initiated. And he had started transfers by council. He will invite all the doctors, they can choose. I was instrumental in starting postings by counseling in health department. I was there for the first counseling. One lady doctor, she chose to go to Veerapanna area PHC on her own. So without counseling, we post them in the wrong place and they're on their own to get their postings done. So the counseling is the best method of posting. They choose the right. Maybe there are 10%, 15% we have to force on people, but still I believe in counseling. So we did a lot of reforms on that. Corruption in medical education. A new college, SHIT certificate, state government will take 2 crores. And then MCI, again another 2 to 3 crores. You know, the president of MCI was caught when he was accepting 2 crores from one of the medical colleges. And one more interesting medical college we had is Deputy Superintendent of Police. His daughter was studying in a private medical college. She comes home tomorrow, you have to give me 30,000 rupees. All the students are paying. I know you are in Lokayukta. If you tell Lokayukta, I'll commit suicide. She blackmailed me. You should not inform, but give me 30,000. All are paying, I should also pay. So he was a little reluctant when he came and told me, then I made him meet the Lokayukta. We called the Vice Chancellor and found this is called not to fail amount. There are 100 students in the final year, all of them pay 30,000. The mediator who collects and distributes it among the examiners. If you want a particular extra marks in surgery and medicine, that's a different package.
For every student,
This is not to fail is for every student. This was happening. So we couldn't control it. I mean, we postponed the examination and then somehow we could stop it. So you can imagine. Also, we found that we have the Karnataka Medical Council. There is the clerk. We take Hippocratic vow and we have to bribe that fellow to get my registration done. The corruption starts from there. That's what I'm saying. From medical education, from the Karnataka Medical Council, we have to sack that fellow. But let me be fair to the public sector. There is corruption in the private health sector, but we didn't have. Lokayukta has no jurisdiction of private health sector. I'm trying to make it part of the NABH and ISO certificate. Nobody wants corruption to be part of it. The quality corruption does not come. Quality indicators it doesn't matter. It's dumped as out-of-pocket expenditure and there's no control over it. We found MNCs were also corrupt. The Philips, Siemens, Toshiba, all of them had BT interests and we were procuring from them. Wipro GE as ethical marketing philosophy, GE manufactures several city because they could not get any tenders. And most of them went to Toshiba, even Siemens was giving kickbacks. Tax evasion, unqualified staff, poor quality. Even today, MRI, if I prescribe an MRI costing about 20,000, I get 25% of it. 5,000, it's called commission and it is deposited in my account. So this type of commissions, unwanted laboratory innovations. So they prescribe 10 to the secret code, test 3, put normal values for the 7 and charge for the 10 investigations. You have to be careful. Unwanted hysterectomies. Hysterectomy is a big thing, not only in Karnataka and several other states. Unwanted angioplasties. So my conclusion, we have technological packages can improve the health outcomes marginally. WHO package, World Bank package, all those packages. But if you have good governance, it can provide a quantum jump in health outcomes. I want to say that when Madan Gopal was there for 3 years, we really had a quantum jump. But we have to prove it with evidence. Unfortunately, we could not do that. If we have good governance, we can definitely have quantum jump. When he was good, the DHO's postings, and I have to say we had women are, in my experience, women bureaucrats are less corrupt than the men bureaucrats. But we had one woman bureaucrat, she was additional chief secretary, continued in the health, and she had fixed the rates. 25 lakhs for a DHO post, postings and transfers, and drug controller was 80 lakhs for the director of medical education, about 1 crore, and of course the Kidwai vice chancellor post are around 3 to 4 crores. All these were fixed. That was a very unfortunate thing. After that, Madan Gopal came and tried to reform. We had one of the terrible ladies. You can guess who she is. So this is the most important. I think this is what I learned from Vivekananda. We need 3 qualities for a leader who is really passionate about trying to do. We need empathy for the poor. We should identify with the patient, with the people who are suffering. That's not taught in the medical college. I still remember my medicine professor, we do what's called palpation, just to see whether they're... So he said, they make fun of it. You also palpate that person, see how much money they have. That's the attitude. Not that the empathy, not the Hippocratic, that empathy in him with concern, but look at how much money. Ability to understand the problem, find solution, and the will to put it into practice. I think all the 3 are very, very important. I was very much influenced by the Eric Fromm. I don't know how many of you have read about Eric Fromm. He's an American psychologist. And he used the word self-love, self-hatred, selfishness, unselfishness, all these are important. I think he said self-hatred. Why do people smoke? Why do people overeat, become obese? Or why do people take to drugs, alcohol? Deep in the unconscious, they hate themselves. They want to destroy themselves. But you should love the body which has been given to you and promote it and take it forward. So we all need self-love and not self-hatred. And love for others comes only when we have self-love. First love yourself, then love for others comes. Very, very important message which I got as a young boy at the age of 16. This whole process in the leadership, IAMB did a study and they call it transformational leadership. But I feel it is a passion. I had a passion at the young age, and that made all this, whatever little good work has been done. I'm also called an international social entrepreneur. When I started my Vodafone, I think everybody said you don't know the business model, you can never make it successful. I made it successful as a social enterprise, and we make 40 lakhs rupees. What we need today is living practitioners of values, and that's where the hats out to people like our director, Madan Gopal, and all of them. I think they are the practitioners of values. No amount of teaching, lectures will have. They all observe us. They know he's uncorruptible. They become really good. And this is what I learned from Gandhi, my life is my message. A leader should have the capacity to say, at least I am following 5% of Gandhi, and that's my message. This is the mantra I received at the age of 16 by Vivekananda. They alone live, will live for others, rest are not dead, then alive. And my own philosophy of life was also given by him. He said, as long as millions live in hunger and poverty, I hold every man a traitor who, having been educated there at their expense, pays not least heed to them. Government spends about 40 lakhs, 50 lakhs on my medical education. Where does it come from? All the matchboxes purchased by tribals, mostly commercial banks. It's for people's money which government gets and they educate. And the knowledge also comes from 400 years of modern medicine, which is given from the society and they educate it. So he says we have to give it back. And that was also, by the way, the concept of yajna. Yajna is sacrifice. We know how to take from the nature, we don't want to give it back. So better to give it back. If you accumulate at the physical level, we have obesity, coronary arteries get blocked. If you accumulate wealth, you have income tax and thieves and all the problems. If you accumulate too much knowledge and don't give it, what happens? You go to lunatic asylum. Better share the knowledge also with the world. It's a necessity to give back. Giving is very, very essential for our human being. And I can say with conviction there is great joy in giving and much more than receiving, and that has to be done. My own classmate, it was praised to go pass ECFMJ, it was called ECFMJ, and go abroad. My oncologist friend, he earns more than $10 million US. He came and visited our project and he says, I don't take salary at all. So I live on 3,000 rupees pension. For a simple life I can lead. And he says I am leading much more meaningful life than. So it's not money which satisfies. I'm not saying that everybody should take what really needs for your sustenance, but not for the durasek. Durasek, I don't know what's the greed. Not ordinary greed. It's too much greed. So for our livelihood, we need to do that. Thank you. This is what I wanted to say. So all of you, I have another exercise for all medical officers. I tell them, today when I sit back, last year we averted 600 infant deaths in all our primary hospitals. If they were with the government, we would have had, if their mortality rate would have lost them. We have saved so many safe deliveries we have provided. List all that and I really feel that I have achieved something, what I could not. But I want the same thing, every medical officer who is in charge of 25,000 population, he should feel that I have saved so many infants. And now we want to give this pride to the villages. We are putting boards up. In this village, there were no infant deaths last 1 year. Let the village health and sanitation committees also. So we should feel that. I want all of you also, with your intervention, you had impact and we have been able to do it. That is the one real fulfillment which is much more important, because all of you are underpaid, I know that. But the reward you get by getting this social capital, fulfillment is tremendous. You should also count that. Thank you everybody.
Question and answers.
Sir, ನಿಮಗೆ ಏನು ರಿಯಾಲಿಟೀಸ್ ಹೋಗ್ಬೇಕು ಅಂತ ಫಸ್ಟು, ಆಮೇಲೆ ಅಲ್ಲಿ ಹೋದಾಗ ನಿಮಗೆ ಹೌ ಡು ದ ಕಮ್ಯುನಿಟಿ ರಿಸೀವ್ ಯು, ಲೈಕ್ ಬಿಕಾಸ್ ಯು ಆರ್ ಸಮನ್ ನ್ಯೂ, ಆಮೇಲೆ ಅವ್ರಿಗೆ ಅಷ್ಟು ಗೊತ್ತಿರಲ್ಲ, ಅದು ಮೆಡಿಸಿನ್ ಅಂದರೆ ಸ್ವಲ್ಪ ಪರ್ಸನಲ್ ಆಗುತ್ತೆ. ಸೊ
ಅರ್ಥ ಆಗತ್ತೆ ಎಲ್ಲ.
ನಾನು ಕನ್ನಡ ಬರ್ತಾ ಇದೆ, ಅದು ಅವರಿಗೆಲ್ಲ ಬೇರೆ ಅರ್ಥ ಆಗುತ್ತೆ. So when I went there, there was no facility there, and they would hide themselves. Actually ನಾನು ಪ್ಲಾನಿಂಗ್ ಮಾಡೋಣ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಅಲ್ಲಿ ವಿಡಿಯೋ ಅಂತ ಇರ್ತಾ ಇದ್ದಾರೆ, ಅವ್ರ ಹತ್ರ ಹೋಗಿ BRNC ಟ್ರೈಬಲ್ಸ್ದು ಸೆನ್ಸಸ್ ಡೇಟಾ ಇದ್ರೆ ಕೊಡಿ ಅಂತ. So they gave something. I went through those hardies, they were non-existent. They didn't have even how many people are living in BR Hills. There was no data available. So I had to start collecting. They were shy. I took one of the local priest family with Chakravarti in Bogota, and we trained him, and he was accompanying me. He used to walk into the interior, and I had to perform some miracles. My first miracle I did was a snake bite case which came. So we make an incision and let out the venous blood so that the poison comes out. And if the blood is not coming faster, you can use the sucker to remove it faster. I used my mouth. It is safe to use the mouth. If you don't have guts, the poison has to get into your bloodstream, otherwise it gets digested in your intestine. But the rumor spread here is somebody who can suck out the poison. And then I would give anti-helminthic drugs that cost me tons and tons of round ones. So medicine is effective. Those are the miracles. Suturing, I have sutured the morning by base. They literally strip off the scalp. And I used to stitch. And wonder drug, the penicillin, they were not exposed to antibiotics. So penicillin itself would take care of everything. It used to heal nicely. And those are the days I got myself trained in. I could do a plastic surgery for a burns patient. I could do a herniography, set fractures. Even dental, I went for 15 days postings in dental. I could pull out teeth, do temporary filling out. So gradually they got interested in me and started coming to us. Then I forgot to show that I found there was no school in the Bihar hills. So I started a school in another caste. I used to live with them, 6 children. Now there are 4 postgraduates. 2 of them are PhDs. Jadia has done PhD in agriculture. He teaches in the forestry college. He is the president of EGK. And another same Mala, he has done his PhD. One girl has done her PhD. That's the education is really, these are the first generation learners. I feel investing on health and education definitely helps. But in the health, you see the curve of improvement of their health. The health curve peaked when they got the land rights and the community rights. So access to my peers cannot cure their poverty problems. So income also, livelihood is very, very important. So we need to work in an integrated way. So for tribal areas, I suggest it should be an integrated approach. Health, education, livelihood. And now we are giving a proposal for the Jainapur bus in that model of doing integrated.
Any encounters with Veerappan?
You were on the kidnap list of
No, okay. Not I was in the list. He wanted to kidnap 4 people. And in that list, according to police, I don't know whether the Veerappan really wanted. My name was also supposed to be there. So they used to give me the protection and all of that. So I saw him when he was caught by Srinivas, one DCM who was a good person. He caught him and I was doing my mobile work. And later on he escaped and started killing all the people. So he first, probably before he kidnapped Rajkumar, he came to our place. That's what police say. He saw and decided it's not worth taking. And I also sent alerts with the drivers that you can kidnap, but you won't get any money. Also, I am a vegetarian. You will have problems eating. Probably understood. So then he went after Rajkumar. And that Rajkumar story, you know,
Yes.
20 crores. Now, I was at that time very closely working with the Lokaayukta and this thing. Inside stories, 20 crores were asked. So one of the ministers in the Congress government, I don't want to name him, so he raised the fund. Instead of 20 crores, he raised about 35 crores, pocketed 15 crores. 20 crores was given to the mediator, the media person. He pocketed about 2 to 3 crores. And then Veerappan got about 70 crores. He did it all the case. He hardly could spend a few lakhs, not even a crore, because only for food and ammunition. And when he was cornered, police took away all the money. That's the story of the 20 crores. And it is authentic. Yeah.
How to reduce the corruption, sir?
Earlier I used to call eradication of corruption. I thought it is like smallpox we can eradicate. By the time I had to leave, I said it is chronic illness like tuberculosis and it can only be controlled. So I feel, so we made several systemic mechanisms to control corruption. And that's where just I want to say one thing. In the procurement of drugs itself, we called all the manufacturers and told them we will have a pay, this thing, you don't have to give kickbacks. So they reduced the rates. We got the same contractors quoting for 50% less. We had plenty of money to flood, so it is possible to reform. And then the e-tendering mechanism came. E-tender is definitely one of the mechanisms of mitigating the corruption. So we can make it to a great extent, but we need good leadership. We need people like Madan Gopal and all of them to reform, otherwise it's not possible. And we were lucky at that time we had a relatively good minister. Sri Ramalu was there at that time, I can openly say. So I still remember he said he had his own helicopter. He said, I don't want money from drugs, postings. None of them he wanted. He gave free hand to Madan. Do whatever you want, I don't want anything. So that, we need that type of, so if you have a health minister, have a rich health minister who will not ask for money from the
But sir, always it is the problem is not only corruption in terms of money. There are so many people who the irregularity is so high. For example, people who are dying.
We also looked at that.
They don't take money, but they don't work.
Yeah. We know, we had nearly 104 doctors who were not working. They come back quietly and join and they were being paid. In Gidwai, one of the lady doctors was working in Dubai. She comes back, applies for sick leave, takes the salary for 1 year and gets the money from Dubai. So all this were happening. There are a lot of absenteeism, all those problems are there. But corruption is corruption. So, and I just want to tell when I was also in the World Bank had a program for secondary care, and they were meeting me as a chairperson, and I said, there are some corruption things have come. So the head of that team, he went and complained to health secretary. The chairman is talking about corruption, how can you talk about corruption? So health secretary wrote a letter saying, how can you discuss about corruption with the World Bank team? I wrote a strong letter. Part of it was definitely wrong, so we want that money to be utilized properly. But I think the message went today in all World Bank logic, there is also good governance. That's when Public Affairs Center became very important. So now when I was in 2004, to say that corruption, I would never use for my presentation, I would camouflage saying good governance in healthcare. I could never say corruption in healthcare. So it was difficult, but today I can talk openly about corruption. And thanks to the Karnataka government to accept that this was there. And I make these presentations everywhere. But also if I had tried this in Bihar, I would have been. Karnataka is a much saner. I don't think people in Karnataka would come and kill us. There were no such threat. Though the fact had given me protection, people are good, sir. In spite of all this, some doctors still hate me. But they're all good, I think.
So it is quite obvious question that you have worked with the governments over the years. Why do you think the policymakers are spending less amount of money? It is closely 1% of the GDP they are spending on the health sector. Whereas our neighbors like Bangladesh and other small countries are spending nearly 2% or more than that. So what goes in the mind of the policymakers? Is it because of the corruption? Or?
No, it is, we need a powerful health minister who can argue it out and increase it with tremendous mission. So they want to see irrigation always gets higher. That's where a lot of contractors and they can make money, including the power sector, all where but health is not a priority. So that's where YSR, I give an example. YSR brought in 108 and the Rajiv Aragya scheme. And he got elected because of 108. He was very popular, at least these two. He was also most corrupt chief minister. But at least he did something. So when I encountered the health minister about this, two things. I had the courage. He wanted to bring in a useless fellow as director. But I wanted one qualified person on Dr. Nagaraj who was there. And he was very upset when Nagaraj was being well, but finally he put his thumb and convinced the chief minister his name was put. I still remember I went, S. Rangnath sent me in his car with the chief minister. I convinced him in the car and we changed him from the corrupt, which health minister wanted to the good director. That's very, very rare, and he did very well. We had that type of option to do it, and that type of reforms can happen. But compulsion, so the health minister was very upset. He did speak to me, he was speaking against, I went and met him. So he said, how do you know? He said, I spent this much money, 2 crores at that time for elections. I had to give this much to the party. Where will I get all that money? So he was justifying how the money was taken. But all this calculation, if he was taking only about 10 crores, it is fine. In the name of 10 crores, they take 200 crores. That's the problem.